are several different areas within the back that potentially could be painful. So for example, within the back there are discs that can be painful, there are nerves that can be painful, there are also joints and muscles and ligaments and other tissues, any or all of which can potentially be causing pain. So part of the evaluation and part of the detective work that we have to conduct when we're seeing a patient is that we want to identify which of these areas is most likely going to be causing the pain. And usually we can do that with a minimum of invasive testing and usually without resorting to a lot of diagnostic testing as well. There are some instances when patients are at higher risk for having serious causes of back pain, such as cancer or infection or fractures. And certainly if any of these risk factors may apply to you, then you will want to let your doctor know about those things so that we can pursue those avenues appropriately and make sure that it's not a serious cause of your back pain.
Jay Pahade, a diagnostic radiologist at Yale New Haven Hospital in Connecticut. I'd like to talk to you about magnetic resonance imaging of the spine, also known as spine MRI. Spine MRI uses a powerful magnetic field, radio waves, and a computer to produce detailed pictures of the spine and surrounding tissues. It's often used to evaluate the structure and positioning of the vertebra that make up your back, to assess for spinal injury, to evaluate for nerve and disc problems, and to evaluate for arthritis. It can also be used to look at cancers involving the vertebra or spinal cord. MRI may be performed with or without a gadolinium-based contrast material.
We can try physical therapy. We can also provide interventions that can decrease the amount of pain caused by the nerves within the back. There are many interventions that we can do for back pain. Some of them include nerve blocks or epidural steroid injections or even ablation of certain nerves within the back.
People with low back pain do not need surgery. Acute low back pain or low back pain for less than 3 months or so will improve on its own no matter what you do in 90% or more of cases. As a result, we take a relatively hands-off approach to acute low back pain. We tend to avoid getting unnecessary imaging of the spine. We encourage people to avoid bed rest. We encourage activity and sometimes physical therapy. Oftentimes we'll recommend anti-inflammatory drugs, but we really don't encourage surgery for acute low back pain. That's because, one, it's not necessary, and two, it doesn't work.
Our job is to make sure that there's not anything harmful going on, make sure you don't have a disc herniation that's pressing on a nerve. Those kinds of things do get better with surgery. But back pain that kind of waxes and wanes generally doesn't get better with surgery. And most of the time we want to teach people to take care of themselves so that they know what to do, so that they don't need to come in and be dependent on somebody else taking care of them. It's better if you know what to do for yourself so you can take care of it without having to come into the hospital or the doctor's office.
Yoga Namaskar. Yoga Namaskar is a powerful system by itself. It activates the lumbar region of the spine in a tremendous way, strengthens the muscles along the spine, giving it a reinforcement so that as one ages, the collapsing of the spine, which causes pinching of the nerves, does not happen, and if already there's damage is setting in, the best way to regenerate your spine would be by doing Yoga Namaskar. It has all-round benefits for the entire body. Yoga Namaskar is a very simple and complete process by itself.
5 top foods to reduce back pain. Number 1. Coffee. Caffeine can reduce pain in those suffering from exercise-induced muscular injury and pain. One study found that a 100 mg to 130 mg caffeine supplement, equal to about the amount of caffeine in 1 cup of coffee, increased pain relief. Coffee delivers a 1-2 punch by reducing pain-promoting compounds and amplifying the effect of other pain relievers too. Number 2. Cherries. Cherries help reduce inflammation by neutralizing free radicals in the body and can also help to stop tissue inflammation. Cherries are powerful antioxidants that work in 2 ways to tamp down pain. They block inflammation and they inhibit pain enzymes, just like aspirin, naproxen, and other non-steroidal anti-inflammatories. Number 3. Salmon. Not only is salmon tasty and a healthy protein, but it's full of omega-3 fatty acids, which have been shown to reduce back pain. In a healthy back, blood vessels at the edge of spinal discs transport crucial nutrients to those discs. If blood flow is diminished, the discs lose their source of oxygen and other nutrients, and they begin to degenerate. Number 4. Ginger. The gingerols, shagols, and gingerones present in ginger are known for natural analgesic and muscle-relaxing properties. They improve blood circulation to the pain areas to provide relief. It contains high amounts of selenium which possess anti-inflammatory properties. It provides relief from pain caused by inflammatory conditions like joint pains, sciatica, and others. Number 5. Water. Stay hydrated to prevent muscle spasms, manage blood pressure and improve digestion. Drink 8 glasses of water daily as dehydration can increase back pain. Drinking more water is a simple preventative measure to protect against developing back pain and can even help reduce existing back pain.